Today I'm going to talk about how to gauge a flu season's severity. There's been lots of headlines in newspapers and on television talking about a super flu based on the intensity of this season's flu. But that's not really a term. That doesn't really actually help you understand what's going on. So there's multiple different ways that I gauge a flu season severity. The most important one is number of deaths. And that's a really easy way to gauge a flu season because either someone is dead or they're not dead. So it's a binary outcome. But there are other things that people look at. For example, emergency department visits, people going to doctor's offices with influenza-like illness, which means cough, runny nose, sore throat, those types of things. And there's hospitalizations. So when you look at the 2025-2026 season, CDC says it's moderate severity, and I think that's a good description of it. What that translates to is we definitely have very high numbers of people presenting to doctors' offices with influenza-like illness. We definitely have high numbers of people going to emergency departments and urgent care with influenza. But what we don't have are record-breaking hospitalization numbers. This is probably since the 2009 H1N1 pandemic, which most people have forgotten about now. This is probably the third worst flu season. The last couple of flu seasons after the pandemic were also worse in terms of hospitalizations. Pediatric deaths, another way to gauge it, there's been about 9 or so, maybe more now, that have occurred. Last year, there was over 250 pediatric deaths, which was the highest number since the 2009 H1N1 pandemic. The other thing I look at is, are we hearing about hospitals in trouble? And clearly, for example, in places like Canada, which got hit harder, they do have pressure on ICU beds. In the United States, we're hearing some anecdotal reports of increased capacity concerns in places like Michigan, but it's not widespread. And it's certainly not like 2009 H1N1 in the ICU. The other thing is looking at antiviral prescriptions and if there's any shortages, which isn't a really great gauge, but it does kind of help you understand the demand. And we're not hearing so much about Tamiflu shortages, although there are spot shortages in places like Macon, Georgia, for example. So right now, the flu season does seem to be pretty brisk. It seems to be moderate in intensity, moderate to severe in intensity, mostly on the outpatient side, not translating into hospitals in crisis. And that's a good thing. And also some benefit to the vaccine, which is really good at protecting against severe disease.